Hi there lovely viewers. If you're concerned about your baby's well-being during pregnancy, this video is for you. Let's talk about signs of an unhealthy baby in the womb. The body of a carrying woman indicates when the fetus is unhealthy. 11 such signs and what they imply are explained here. Let's take a look. Lack of heartbeat. A baby's heart starts beating around the 5th week of pregnancy, but the detection is easier around the 10th week or towards the end of the first trimester with a Doppler test. Sometimes, a heartbeat cannot be detected. The position of the baby or placement of placenta can be the real reason. If the same happens on the next try, the fetus might be in a stressful environment or even worse, it must have become lifeless. Excess cramping during pregnancy. This can happen at any phase of the pregnancy. In early pregnancy, it is the flow of blood to the uterus that results in cramping similar to ones during menstruation, which is normal. However, if cramping is severe, persistent, or accompanied by other symptoms like bleeding, it's important to consult a healthcare provider to rule out any potential complications and ensure the well-being of both you and your baby. No fetal movement. The baby's movement is felt around 18 weeks and it gets stronger when it is 24. But what if baby does not move around for a while? It is said that a mother should experience 10 kicks in 2 hours' time, which shows a healthy fetus. You can move the fetus by stroking the stomach, talking to the baby, or drinking sweet drinks. If there is no response, immediately consult a doctor. Smaller fundal height. Fundal height is nothing but the measurement of the uterus. It is taken from the top of the uterus to the pubic bone. If the fundal height is too small, it could suggest fetal growth restriction, placental problems, or a smaller than expected baby. Conversely, if the fundal height is too large, it might indicate macrosomia, a larger than average baby, excess amniotic fluid, or multiple pregnancies. These abnormalities could be signs of various health concerns for the baby, such as genetic disorders, gestational diabetes, or other complications that need to be monitored and managed by healthcare professionals. Bleeding during pregnancy. Bleeding from the vagina is definitely a matter of concern during the pregnancy. Even a small spotting must be reported, so that you can make sure that your baby is safe. In some cases, the chances are that vaginal bleeding can be due to miscarriage, hormonal bleeding, or implantation bleeding. It can also be due to problems with the placenta, in which case the baby is delivered earlier. Vaginal discharge. This is common for a woman and it only increases as the pregnancy progresses. Vaginal discharges are usually clear, transparent, and colorless. However, if the discharge is accompanied by a strong odor, unusual color, itching, or irritation, blood, or pain is spotted, it could indicate an infection that needs medical attention. It might be a case of cervical inflammation, where the cervix opens up earlier indicating a miscarriage. Severe back pain during pregnancy. Back pain is common when pregnant and this is because the body takes up excess weight than possible as the baby keeps growing. This puts a strain on the spine, especially the lower back. If the pain does not go away for long and is very much persistent, that is a warning sign. It might be due to kidney or bladder infections, preterm labor, or even a miscarriage. Lack of morning sickness. For most women, morning sickness lasts until the end of first trimester, but there are some lucky ones who are relieved from it earlier without any issues for the fetus. However, in some others, the sudden lack of morning sickness might be due to low HCG levels, indicating a miscarriage. Fever. Fever during pregnancy should not be taken on a lighter note. This can sometimes obstruct the growth of baby with a bacterial or viral infection. The mother must make sure that the fetus is safe while running fever and take appropriate measures. For some, fever can signal a miscarriage. So, it is better to ask your doctor's opinion when in such a state. Reduction in breast sizes. Breasts are the ones that start becoming very sensitive due to hormonal changes. They also start feeling heavier, fuller, and this increases as the months pass by. A sudden decrease in the size of the breast might occur if the body does not support the growing fetus any longer. The hormones get back to the old self when the pregnancy stops, leading to the reduction in breast size. A sudden spike in blood sugar levels during pregnancy, particularly in women with gestational diabetes, can potentially impact the health of the baby in the womb. Uncontrolled high blood sugar levels can lead to fetal overgrowth, macrosomia, which increases the risk of complications during delivery. It can also lead to other issues such as excessive amniotic fluid. Managing blood sugar levels through diet, exercise, and sometimes medication is crucial to minimize risks to both the mother and the baby's health. Every pregnancy is different, and symptoms can vary greatly from woman to woman and even from pregnancy to pregnancy. If you notice any of these signs or have concerns, don't hesitate to reach out to your healthcare provider. Take care and see you in the next video.